South Korea. Now that is one country that we've been hearing a lot of recently with the growing COVID-19 pandemic. That is perhaps because they have been reportedly successful in flattening the curve on the virus in only 20 days without even reinforcing extreme restrictions on the public. Is that somewhat surprising? Well, according to University of Oxford's stringency index, yes. The index tracks new policies introduced during this pandemic, including school and workplace closures, public event cancellations, and restrictions on internal and external travel. In this, South Korea scored a mediocre 81 points. Regardless, as of April 25th, they had 10,718 confirmed cases of COVID, but only 240 deaths. What's more, their curve of cases is actually flattening. While they were registering over 500 cases per day in early March, that number is now down to around 30. How can that be? Alper Özden, the first Turkish consular to South Korea, who was there to witness the action, shed some light to the case. By late January, the Korean public started realizing the scope of the issue. But the real turning point came in the third week of February, according to Özden. By then, there were only 30 patients detected.
So the 31st patient, who was an old woman actually at the age of, I think, mid-70s. She was infected, and the background check showed the authorities that she was a member of a larger religious congregation in South Korea, and she had participated in two big indoor religious gatherings, which created a risk of spreading the virus to those people who participated in this religious gatherings. Just in 10 days, the number increased from 30 to 2,300.
What came after this turning point was the real reason that brought the success to South Korea.
So they changed their strategy. They allocated all state resources, the police resources, the intelligence resources, the military resources, I think also the Ministry of Health resources for this point as a grand strategy. They really devised a grand strategy. They shifted from just wait and see policy to a really proactive and aggressive strategy, and started finding out those people who have infected from this virus, and also made background checks, also reached out to those people who had in the past 14 days had any contacts with those people.
Mr. Özden groups their strategy under three main components:
investigate, detect, and test. These are the main three pillars of their strategy.
Investigate, detect, and test. This strategy requires immense data collection, tracking, and identification. He named 3 ways to collect this data: credit card records, cell signals, and public cameras. This system, reinforced by the police organization, allows the authorities to track people's whereabouts for the past 14 days and test them if they were in a location where they could be infected. People are then notified of this risk through an SMS system. Another thing necessary for this strategy: an incredible amount of transparency.
They also started putting forward a very clear and transparent information sharing policy as well. This is very critical, very important. I think it's one of the best examples for the rest of the world as well. Governments sharing information which is related to public. I'm not saying all the information, but which is directly related to public, not keeping them for themselves or hiding this information, really helps. What does it help for? It helps for keeping you away from misinformation. It keeps you away from believing in those misinformation and circulating in social media, for example.
A surprising component of the Korean plan was their approach to hospitals. First, they announced that those treated for the coronavirus in a private hospital would even be covered. Their second tactic was the so-called drive-through facilities.
They kept many people away from hospitals who think that they might be infected. Instead, they established drive-through facilities that you can drive your car into, like a McDonald's drive-in.
Through these drive-through testing systems, an individual could get tested and learn their results in the span of 48 hours without having to expose themselves to the hospital environment. If the test results were positive, the government sent ambulances to the patients to take them to a hospital. Many more precautions were taken by the public, including social distancing, masks, and hand sanitizers. But many restrictions were simply advised and not imposed. Perhaps the success is hidden in the incredible public compliance to these suggestions.
It's a matter of culture. It's a matter of cultural habits. South Korea is a very unified country in terms of cultural habits and customs. So it also helps them comply with all these requirements. If you compare South Korea with the rest of the world or otherwise, because South Korea is not a multicultural country like the United States or like Europe, even like Turkey as well. They are much more homogeneous. So that's why it was much more easier for them. And wearing masks, for example, is quite critical and important. But this was something they have already been accustomed to. So this was not something foreign to them. So the transition period for them for this situation, for this period, became even much easier for them. And that's why nowadays all the countries skyrocketed in the numbers of infected people, whereas South Korea is in the position of diminishing in the number of convicted people.
Mr. Özden says that it was the public confidence in their government that helped better contain this problem. This confidence is evident in the parliamentary elections held on the 15th of April, where the governing party won with the largest turnout rate in almost 30 years. In this pandemic that has unfortunately taken countless lives and has shaken the world to its core, it's critical to turn to examples of other countries, learn from their mistakes, and look up to their strengths. Perhaps South Korea presents a significant case that policymakers can refer to in their attempts to contain and combat COVID-19.